As we have all week long, we're answering your most pressing COVID questions, taking them straight to a Metro Health hospital doctor.
Community Strategy Manager Michelle DeSelms is live in studio.
Yeah, those questions just continue to come in, and we want to get as many answered as possible. Dr. Rakesh Pai from Metro Hospital is here now to help out. He is the president of the Metro Health Group there. First off tonight, getting a lot of questions about testing tonight. So what is the procedure, doctor, in terms of who gets a test?
Thanks for asking that question. It continues to be a little bit of a moving target. I would say that patients that begin to develop symptoms, particularly after being exposed to a patient with a known diagnosis of COVID-19, if they start to develop symptoms, that would be somebody that we would absolutely want to test. In addition, those kinds of patients that present to the hospital with severe shortness of breath, fever, cough, and known other etiology, I think those are also people that we'd want to move very quickly to test. And then certain other vulnerable populations, think about patients that have a weakened immune system, think about healthcare providers that are on the front line, like physicians and our advanced practice practitioners, and potentially our paramedic staff. If they're exposed and develop symptoms, we'd want to test those people rather quickly. And I'd say lastly, perhaps our nursing home population that are clustered together very closely, should they develop symptoms, we'd want to have those patients tested as well.
And I know there is a little bit of lag time. How long until the results come back, and then what should people do while they're waiting for those results?
Great question. Generally, results are back within 48 to 72 hours. It's really important for patients to remain at home, sort of in self-isolation, washing their hands, washing surfaces, covering their cough, things of that nature, social distancing.
Well, we do have a lot of people asking about social distancing and exactly who is considered safe to have contact with. So here is our first question now. Renee says she and her husband don't have the option of working from home. So is it okay that her parents watch their child?
It turns out that the most vulnerable populations are adults in their 60s, 70s, or 80s. I would say if your parents are in that age bracket, you'd probably want to keep the children away from grandparents right now. Turns out children have very mild symptoms, nothing more than a cold. They don't get very severe illness. It doesn't even really slow them down should they contract COVID-19. It's really important to protect our elderly and vulnerable populations, particularly if they have more chronic conditions like high blood pressure, heart disease, things of that nature. We want to probably keep the kids and the grandparents away for now.
All right, sure. Another viewer has this question. My 14-year-old keeps getting invites to hang out with his friends overnight. I'm saying no, but other parents don't see anything wrong with socializing. Am I being too cautious?
Yeah, great question. I see that in my own neighborhood in East Rapids. Frankly, I think the kids being out of school, this isn't a snow day. I think it's really, really important to keep families separated and children separated. I know it's really hard to do. It's really important to take these recommendations very seriously. The best way to stop this virus cold is to really keep our distance from one another, and that includes the kids, unfortunately.
All right. Well, James wants to know tonight why it's not mandatory for everybody in Michigan to wear a surgical mask to help prevent or possibly stop the virus.
Great question. I think the main driver of the answer to this question is really right now personal protective equipment, which are things like masks, goggles, and gowns, things of that nature, are at a severe shortage, and we want to make sure that our healthcare providers on the front line have adequate amounts of personal protective equipment to protect them first and foremost. We're hopeful that with these public health measures, social distancing, cleaning surfaces, covering your cough, and staying apart, will really hopefully drive down the number of new cases of COVID-19.
Okay, so this next one from Luella, also about protective gear. Should non-healthcare adults wear disposable gloves for things like receiving delivery items?
You know, that's, again, a little bit of a moving target. From what we know so far, the virus doesn't seem to, it can stick to some currency, coins, maybe perhaps some cardboard packages, but it really depends on sort of the UV light exposure, heat, and things of that nature. So it's a little bit of a moving target. We're not really sure, but it's probably best to be precautious.
All right, Lori's asking tonight about donating blood. She says, I'm well. I want to give a pint of my O-negative blood. Should I donate locally so my blood stays here in West Michigan, or go to Red Cross where it would be used nationally? Where is the greatest need?
I think either place would be perfectly fine to donate blood. It's just really important to have those resources available to any part of the country or our state. I think it's really important that we continue to donate.
We're at a great need right now. Okay, so Alan wants to know, can coronavirus stick to your money or currency and be passed on to somebody else? Can it be transferred to other people by the U.S. mail?
Again, we don't think that that's particularly common. I have heard reports that it can perhaps stick to bills for up to 2 hours or pennies for 3 or 4 hours. I believe packages or cardboard remain low risk. So like anything, it's really important to wash your hands after you handle packages, money, or coins. Very important to take those precautions.
Okay, so Annie is a viewer who tells us that she has heart and lung problems. Her husband continues to work, so how can she make sure she and her son don't get sick?
Yeah, I think it's really important to, once again, take those precautions that we've been talking about. Perhaps to take off your shoes as soon as you come into the house. Wash your hands for 20 seconds, which is a lot longer than most of us wash our hands. That's the amount of duration of hand washing that's required to really scrub that virus from your skin. Really important to cover your cough and remain, 6 feet apart or more.
Yeah, so it sounds like, Dr. Pai, anything that's coming into your home, yourself included, make sure you either take it off, maybe change into different clothes once you get home, and then, of course, any kind of packages or anything like that, make sure you're sanitizing and, like you say, washing your hands well after you touch them.
And clean those surfaces, really important.
Clean the surfaces. All right, well, we really appreciate everything you and Metro Hospital are doing. Thanks so much for joining us tonight.
Thank you for your time.
To you at home, keep submitting your questions to us. You can email us at community@woodtv.com or post on the Wood TV Facebook page. The experts from Metro Hospital will join us live every day at 5:30 to answer your questions. And if you're looking for answers, go to the Wood TV webpage. We have a list of frequently asked questions about coronavirus.